you're bleeding, what you would do, you would, of course, wear gloves. First off and foremost, put the gloves on. You would sterilize the area, say it's a gash in the arm, sterilize the wound, alcohol swabs, um, just in case, just to clean the area so that it doesn't get infected. Then you would get a clean and sterile bandage, wrap it around the wound tightly, or as tight as you can make it without it physically hurting the person that has the injury. Um, just apply as much pressure as needed to stop the bleeding. Gloves. For a broken bone, obviously you would not want the person to move to further the injury. You would need to apply pressure around the wound with a sterile bandage, clean cloth, a clean piece of clothing, anything that's readily available. And since medical attention, if a stick is, or a bone is sticking out, um, uh, make a makeshift sling if you're not in the presence of a medical professional that has the tools necessary to fix it properly. You don't want to worsen the person's injury. To reduce comfort, of course, pad the sling so that it's not stiff, the person's comfortable, they don't want to have to take it off to get more comfortable. The sling has to stay on there for as long as possible until they can get medical attention. Use ice directly on the skin, wrap it in a towel to lower the swelling down of the injury. You don't want it to get inflamed and swelled. For slings specifically, a dislocated arm, let's say your shoulder popped out of its socket, try gentle massage maneuvers to try and get it back in place. Don't just forcefully push it back in. If you're not a medical professional and you don't know what you're doing, don't try to fix it yourself. Um, the sling can stay on for a couple days, up to a week, um, just in case you're in a situation where you can't get to a medical professional right away. Makeshift slings can be made out of bandages, pieces of clothing, preferably cloth, blankets. Make sure it's padded, of course, so the person is comfortable. Use ice to lower swelling. Rehabilitation is needed. General anesthetics, just in case they have a headache, or painkillers if it's just so unbearable. Use it if it's available. Head injury. Of course, use ice packs to reduce the swelling of the head. If they're wearing a helmet, don't remove it. It's keeping the swelling in to prevent any further brain damage, so it's preferable that you would keep it on unless it's obstructing you saving their life. Um, they should avoid taking medication unless their doctor says that they can after the injury has been diagnosed. It could interfere with their recovery and everything. The first 24 hours, somebody should constantly and regularly check up on the person. If they're confused, they lose consciousness, they show signs of memory loss, you should see a doctor right away, and you shouldn't put it off. They shouldn't be drinking, doing drugs, driving. They shouldn't be playing contact sports like baseball, basketball, football, anything like that, any outdoor or indoor sport that requires you to run around and jump, because it could be led to a concussion, and those can worsen. There's different severities of concussions. It's just generally not a good thing to just brush off. Um, they should take off time off work or school. Stress could also escalate the swelling of the head. So that's another thing that they should also be watching out for. Again, regularly check up on them. So for an impaled object, um, say somebody has a knife or anything else stuck in their leg, um, don't remove the object. Only remove the object when it interferes with CPR, if it's obstructing the person's airway, if they can't breathe correctly because of it, then that's a perfect time to remove the object. Other than that, if ambulances are not available or the patient must be moved, it's necessary to secure the object, which you wouldn't think to do, but making sure that it doesn't move is very, very important because if it moves, it could cause more pain for the victim. It could be lodged deeper in, it could be moved around. It's never a good situation. And the more the object sticks out of the body, the more leverage it has to do damage to tissues. Because with an impaled object, it applies lots of pressure in the blood, and by taking it out, it releases that pressure, and blood flow can continue normally, but more so at a rapid rate. And it's just necessary to keep it in unless it's, like I said, obstructing the airway. Um, of course, let's say the person is going into shock. Um, uh, just lay the person down, elevate their feet slightly, unless you feel like it'll just worsen what's wrong with them. Like if it'll just worsen them not being able to breathe, then don't do it. Make sure that they're warm. Put a blanket over them. Don't let them eat food or drink anything. Try to keep them awake until medical professionals can get there or until they can get to an actual medical facility like a hospital. Um, Lay them on their side to prevent choking. Um, of course, like that's only in case if they're coughing and they have trouble breathing. If not, then it's completely fine. Nosebleed. Very general. Everybody has them. I've had them lots of times. Generally, for what you would want to do for a nosebleed is pinch the bridge of your nose. Of course, get a tissue, cloth, paper towel, anything to hold under. Lean forward, not back. You should always lean forward so that the blood doesn't go down your throat. Most people forget that the nose is connected to the throat and they tend to lean back when they do it because that's what everybody says, but then they end up coughing up blood because it's going down their throat. Um, it's just make sure wash your hands afterwards. It can be a very messy process. Um, but other than that, thank you for allowing me to speak about this, and I hope that the information that I have shared is helpful to you. And have a good day.